Hello, everyone. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley, and today I have one of my special friends, Dr. Jess Peatross. She is here at A4M with me, and I am so thankful that we got to see and connect with each other. And you guys have seen her on Instagram. You guys have seen her talk about from all things inflammation to drainage to toxicities. She's a medical doctor that has a different perspective on health, which is refreshing to me. And I'm just going to say, we're going to brag a little bit more about you. And we're going to talk, we just discussed like terrain theory. We're going to talk about interferences in your health that you may and I may overlook. And she's the perfect person to talk about. So thank you so much.
Thanks for having me, Dr. Motley. I appreciate it.
Oh, we have our cups of coffee.
We do.
We're ready to rock and roll. So first things first, I know that individuals, oh yes. Cheers. Here we go. All right, guys, we're ready. Esteban's back there. He's running the show, so we're really glad that we're here today to give you guys some information about these subjects. But one of the things I like to do, I know people know who you are, but also there's some people that may not. So can you give us a bit of a background to let them know?
Yeah, sure. So I started out as a traditionally trained conventional medical doctor, and I was board certified in internal medicine. And for almost 7 years, I worked in the hospital as a hospitalist. So, putting central lines down people, putting on the ventilator, admitting the ICU or the floor, and really I had to know something about everything a little bit. And then I just started to kind of see cracks in the system. I just started to see, I'm just charging these people on 40 different medications. That's not really health. They've got all these crazy different foods in the hospital that aren't conducive with health.
Yeah.
They have Pepsi and Coke and like Cheetos and, like white bread that's like, I don't know, whatever brand. And so I would go down there, I'd just be so disappointed. I would like kind of gripe at the cafeteria staff like they could do anything about it.
Yeah.
But, they labeled me a disruptive physician.
For saying that?
Yeah, because I would say something every day, like, it came to the point where I was so irritated and they were probably so irritated with me because I was right when they had started electronic medical records.
Yeah.
And so I wrote in the chart that this patient who came in the ER had been on a proton pump inhibitor like Prevacid or something for acid reflux for almost 8-9 years. And the package insert says 6 months to a year. And so I wrote in the electronic medical record, this is a liability. This patient has been on this medicine this long. And the primary care doctor is an outpatient doctor, called the lead hospitalist to gripe about me.
No.
And said she's the liability when I wrote that in the chart about him because he prescribed the medication. So I could kind of see, it's almost like doctors protecting doctors and their bad behavior a little bit. And I could see this is just how the system is. It's broken. Just deal with it was what I was told.
Yeah.
And I wasn't going to do that. I wasn't just going to deal with it. So I ended up quitting pretty much then and there.
Yeah.
And I jumped really fast. Like, I don't know if I would have done it had I known that I was going to make a fourth of what I made in the hospital.
You just stopped.
Yeah.
You quit.
Yeah.
Was it that decision, though, that you were like, I'm fed up, and something just clicked in your head, and you're like, God put some kind of thought in your head and said, you don't belong here?
I think there was a slight inkling that perhaps they didn't know they didn't see my perspective. They didn't see the inauthenticity in the system. And maybe if I pointed it out, they would be like, oh yeah, we could do something about this.
Yeah.
But I was wrong. I came to the point when I quit that I was like, you know what? I can't change this system alone. I have to go out and do something different because I can't fix this broken system. And that's what when I quit, that was my realization.
Wow. But did you find, because, the people out there are thankful that there's doctors out there that would look at somebody who was on that for that long and say, hey, they actually are looking out for me. Did you feel a certain amount of peace when it came over, when you left? I know there could be fear, but it's like, because you're making a fourth of the money.
Yeah.
But now looking back, like, what's your thoughts are like, oh, so glad I did that.
Yeah, I'm so glad I did it because now I feel like I'm actually serving my purpose and I'm actually able to help people genuinely. And I think a real doctor's merit should be how much medicine can you get people off of? We should be incentivized that way.
Wow. That's a great incentive, right? Because like it's the old Chinese medicine what's the word? I can't even think of it. It's adage. That's the word. They say that the doctor is only paid whenever, they're not paid when you're healthy. I'm sorry. they're not paid when you're sick, but they're paid when you're healthy. And I was like, I was like, you know what? That's pretty good. I mean, I've thought about that. It's like our whole system's kind of backwards to the Chinese medicine world, you know?
It is, because the ultimate goal is how do you make money on people who are healthy? And it's really hard to do that. People who can think straight, their body's straight, their mind, their emotions are straight. It's really hard to pull the wool over those people's eyes and make money off of them.
That's right.
And unethically. But if they're sick and their mind is hindered and their body is hindered or handicapped, it's easier to keep them in the system making money. So the system is completely backwards. It labels everyone. Here's a medication that fixes you for life. And then we never look at any other perspectives about what root cause might be. And then we incentivize them to keep people on these medicines forever. That's how the system makes money. It's like so broken.
It's crazy because even like I have family members that have been different medications, and I do my work, and thankfully I found some doctors that would look at some of the reports. But I think it's really alarming though. It's like, for instance, my mom had been in the hospital for some heart stuff, and Western medicine has its place with emergency. I totally get that. But then after a while, did you see that like she would have so many medications given by one physician, and another one would add more onto it, and then was in the hospital. People out there probably understand. They're like, man, I got to make sure my family member's okay.
Yeah.
I know a bit about some things, but at the end of it, though, like they were sending like the pharmacy different like orders from so many different doctors, and by the time there's like 11 or 12 medications.
It's called chart wars.
Really?
So the famous one that is always brought up is the nephrologist, the kidney doc versus the cardiologist, the heart doc. Because the heart doc is only concerned about the heart and wants that, but then he kind of compromises the kidneys. And the nephrologist come in and said, no, the kidneys are most important. You can't do this medication and da-da. So it's kind of almost like they fight like passive aggressively in the chart.
What?
It happens all the time. And so
they actually can get upset with each other.
Oh yeah, because they don't understand that the body works as a whole synergistically. They look at these separate organ systems and say which one's the most important. My hierarchy is higher than yours, and it's almost like it's the ego. It's like
a whole battle of egos and individuals having chart wars. Yeah. That would be a great movie.
Chart wars.
I'm sorry.
Fighting doctors.
Yeah, like dressed up like Star Wars characters, except they're doing charts. Okay, everybody's going to be like, that's ridiculous. But it'd be a good idea. Anyway, so there is this fight. So when you were coming out of it, you started going into functional medicine.
Yes.
Like when you're talking about terrain theory. So not trying to take too big of a shift, guys, but I can't explain terrain theory like Jess can. So I'm saying like, but there is.
Sure you can.
But I'm saying terrain theory in the sense that when you look at the body, I mean, you're really saying in one aspect, can the body be healthy enough to do what it's doing? But can you give us an explanation about terrain theory?
And I'm actually going to back up before I give you a definition because I want to point out a very not so clear perspective, possibly for the general population about this, is that what is the key to seeing this theory is understanding the human body. And so if you're someone that thinks that your genes are a life sentence, or that you're broken, or that you can't heal, or the body is not your friend, it isn't intelligent, always trying to heal you, there's something wrong all the time, it's sinful, it's bad, you're not going to see the terrain theory as well.
Wow.
But you have to understand that the body is an intelligent vessel, and even when you get sick, even when you get cancer, it's like, what is it trying to heal you from? Even fibroids and different types of adenomas are the body walling something off from the bloodstream because it's so intelligent to protect you.
Wow.
So like you have to look at this perspective that the body is perfect and beautiful the way it is, and even if you get sick, it's really a healing process. And so with that being said, now with terrain theory is the belief that the germ is not that much, and the milieu is everything. Or the body, the terrain and the vessel of the body, if that is clean, you won't have recurrent infections. And I'll use examples to drive the point home. For example, if you have a dirty wound, you might have maggots in it that clean it up, right?
Oh, yeah.
When there's an oil spill in the ocean, the red tide has a higher propensity to occur there to clean up the oil spill.
Yeah.
There are trees that when they're ill will get termites, and you can see the termites, and they're actually there because they're healing a process with the tree that's ill. So all these things that we think are bad, infections and all this stuff, what is it there for? We know bacteria digest organic waste.
Yeah.
We know that mold, that's what it does. It digests decaying things. And so if you're putrefying your food in your gut, you're going to have a problem with maybe SIFO, small intestinal fungal overgrowth. You're going to have bacteria like SIBO there. You might have issues with recurrent infections, because it's the trauma and the toxins and the adrenaline in your nervous system dysregulation that keeps those there. They feed off that stuff. They're digesting it for you. So they're not the problem.
They're actually symbiotically trying to help you with the condition.
Correct.
So when we see SIFO or SIBO, anything, our mindsets need to turn a bit and say, why is this overgrowth occurring?
Correct.
Because there could be some toxin, like the red tide, it's a beautiful example, in the body, and it's overgrowing because our body's allowing it. There's an innate intelligence.
Correct, exactly. And there's an emotional aspect to it too, which I know you love.
But I would hear this.
So, Candida, for example, is what's eating you up inside?
Yes.
Literally and figuratively.
Dude, this is so good.
And so, there's always an emotional aspect to these things, right? And so, a lot of people that I see that are sick, and I'm sure you do too, have histamine problems, itchy, puffy, bloated, brain fog, rashes, and mast cell activation syndrome. Yeah. And this is a lot of times from their thoughts, which set off certain neurotransmitters that like a hardwire, neurons that fire together, hardwire together. Yeah. Right? It's like a truck stuck in the mud. And so then everything they see is a foreign intruder that the mast cells release histamine to protect you. Until I can calm them down in their thoughts, it doesn't matter if I kill anything in their body.
Wow.
It doesn't matter because the thoughts are going to release that noxious substance every single time and keep them ill. And so it goes back to their thoughts and their trauma, and that they're stuck in sympathetic overdrive or functional freeze.
Functional freeze. So they're in overload. They literally, if they're itchy, bloating, and they're like in a hyper fired state, and you're like, well, you're in a fired state in your mind, and so your body creates that relationship.
It's protecting you.
Yeah.
Look at what you're thinking.
That's exactly. So it's actually responding to how you think. Like they were saying, oh, this is beautiful, because when there's one aspect they would say, like in the Chinese medicine world, and you've seen it like in Ayurvedic, where they'll say like, well, part of your lymph system will respond to how you think. Like you'll go, if you say like, I'm not going to take care of myself, your body will listen to you.
That's right.
And it will do what you ask it to.
That's right. I mean, I'm so glad you brought up the lymphatic system, because that's a deep emotional system. Oh. We want to talk about spirit, science, and emotions mixed with science. I mean, that's the emotional shock absorber.
Really?
When something happens in your life.
Keep going. Yeah, this is great.
Yeah. I mean, it's where cellular memory is. We're 70% water, and water is structured. Yep. And if there are toxins or metals involved, it can't structure properly. So the harmonics of the body are off. And that's all in a piezoelectric system and lymphatic system and fascial systems.
And it's a shock absorber.
Yes, an emotional shock absorber for stress and trauma. Because it contracts. And it flexes with your body, and if it contracts down and it's smushing all the neurons, they can't fire properly. Your autonomic nervous system isn't working as a whole properly, which is what happens with scars.
So,
I just threw so much at you. Sorry.
This is great. Okay, so if the emotional resiliency of your body is dependent, or it's represented by your lymph. So if your lymph system is congested and you have slow lymph and you're puffy, you would say you have some emotions.
Yes.
You are getting hit by emotions.
You have some trapped, stored emotions in your cellular memory that and I can almost guarantee they're waking up at certain times at night where the organs are overworking.
And they're asking you when you say it to them on your visits. They're like, "How do you know that? How do you know?"
Yeah.
You're like, because the resiliency part of it is missed in our culture, and you're making sure that you don't miss that part of, I guess it's, triad or, body, mind, spirit. But what about when you said scarring? Because now you're making me think like there's the lymph pump, like you're guarding.
Yes.
But then scarring, like, it doesn't mean I'm emotionally scarred. I'm scarred, or like, what is that?
Well, not necessarily. I love that analogy.
But I want to hear what you say about scars.
That.
Yeah.
So, keeping your terrain clean as you can, scars can be something that is an interference in the body, meaning that it's a place the body is constantly going to provide energy because there's something stuck there or stagnated. And, stagnation breeds disease. So
that's good.
In a scar, you got to think the scar tissue is hardened. It's gotten thicker to protect you because there's been an injury, right? It's thick. You know, it's almost like a keloid you can feel on some. I have a little keloid up here. I pierced my ear in high school.
Yeah, I one too.
So you can feel it's hardened up to protect you. Well, what happens if you have a big scar in the midline where a lot of the meridians run, where a lot of the energy and the chakras are? You need things flowing properly here. So a scar is like kind of congested fascia. It's all, you know, stretched improperly. It's contracted improperly. The nerves can't fire in there properly. So if you inject the scar along the plane, and you can inject homeopathics or a local anesthetic like lidocaine or procaine. Procaine, and it acts as a vortex to drive the homeopathics in, and they're like liquid acupuncture, talking to the body.
Wow.
And so what that does is it opens the fascia and gives it another chance to relay properly, right? It's almost like sauna does for heat shock proteins in our brain. It lets them unfold and refold properly again, and same with the fascia.
So it's like, it's sort of like bumping it so it like pops back open again, like a spring that's been compressed.
You're stuck. You're not firing properly. Come on. So, you know, once you do that a few times, like you could actually peel a C-section scar off a woman and it's gone after you inject it maybe 20 times.
Heavens, are you serious?
Yeah, and then their anxiety will be gone because it's a midline scar that infects their energy meridians.
Oh my word. Okay. Okay, everybody, seriously. I had, it's blowing my mind because I had a stomach surgery in 2017, had a ruptured ulcer.
Oh my gosh. That's scary.
It hurt. It was like, it was the worst. Like, I never had a baby, so I'm not trying to make light of that. But I was like, if this is what childbirth would feel like, I mean, it hurt bad. It was like somebody stabbed me. Well, the scar that was there, one of my friends in Austin, I didn't know much about Procaine. I heard about it. And I want to tell you guys something. I mean, when you say peel off, I got it injected. He goes, let me put some Procaine in there. And I remember, because I still have problems with it, I still have to do fascial release and I have to do lymph therapy and laser on my scar.
Laser helps a lot too.
I do a lot of laser, especially when I'm driving. I'll sit there and I put the laser on my stomach. Literally, I'm not kidding. I'll be like, huh? And people are like, you know, if they see me in the car with a laser on my stomach. But I remember when I feel so good. And I got the Procaine, and I'm telling you, you're right. I got out of that. I mean, I was like, it felt like I was actually connected to my body.
Yes.
Like I felt like emotional. I would like, why am I welling up? And he goes, oh, it happens all the time. And I was like, well, that's easy.
All the time.
All the time?
All the time. People will feel their hands and their feet numb and tingly. They'll start sweating. It's literally a release.
And you finally release. So when you find these things that, like, you have the lymph, you have the scars, you're finding these techniques to release them. You're on the cutting edge because, you know, you're at these conferences and you're learning all about these things. When you find that there are those interferences, we have scars, we have lymph. What are some of the other ones, like, you know, people out there that have, and they're like, dude, I have that. What are the ones
The most common thing, unfortunately, are root canals and mercury amalgams. And I hate to be the bearer of bad news with this. Breast implants are another one.
Oof.
There's
a lot of stuff on that.
Yeah, there's a lot of stuff in there that you don't want in your body, for sure. But, you know, root canals, really, it's... they all have metal. Metal always oxidizes. They are the only place we leave in necrotic tissue and think it's okay. And it's not, because they leave the periodontal ligament, which tells the body, the immune system, not to go there, that it's taken care of, but they cut it off from the blood supply. So there's thousands of tiny porous channels within the tooth where bacteria can hide. Parasites can hide, Lyme can hide, fungus can hide. They found mold in tooth sockets before. They found Lyme in microscopy from root canals and teeth.
What?
So unfortunately, root canals are a place where the body constantly has to go because there's a pocket of simmering infection there over time. They usually only last 8 to 10 years. They're a man-made procedure in a not man-made body. I don't know what to say. And same for breast implants, 8 to 10 years. And there are certain genotypes that are a little more predisposed, you know, that aren't as strong or resilient. But ultimately, these people, these canaries in the coal mine, are showing us it's not good for any of us.
Wow. And so when you get we're not being doomsday. We're just saying that when you have the root canal with that ligament, so you have a reduced amount of blood supply that can get there. You have tiny holes in your tooth where infections can fester.
Correct.
Is that why, like, I had a friend of mine go get her upper gum. She got like a cone beam scan, and they literally pulled out like these pockets, these little like green looking balls.
Yes. So she had a cavitation, which is that pocket of infection, and it can actually eat away at the bone. There's no symptoms. You'll just be systemic symptoms, not symptoms right here at the mouth. That's why it's confusing.
So it's all over the body, and it is.
Yeah, it can cause autoimmunity or infertility depending on what meridian on the tooth it's on, what organ it attaches to.
Oh,
So I've seen cavitation surgery before. They just took a little hole, and what happens when that pocket of simmering infection comes out, it looks like oil just coming out, oily stuff coming out of the gums. It's wild.
Is it crazy? So this stuff has infections just festering inside.
Correct. And it's a pocket, so the body can't, it's like a walled off abscess. The body can't penetrate it well. So it's constantly sending white blood cells and other things there to fight for you and pulling energy away from other processes in the body that the body might need it for.
And so when it's pulling away energy, you refer to the tooth having like an association with organs. So you're saying that there's certain meridians or lines that you go to each tooth.
Correct.
So what talk a little bit about that.
So I don't know the numbers and the organs right off the bat because we'd need a tooth meridian chart for me. But yes, so I will tell you, for example, wisdom teeth, those are on the meridian with a lot of different hormones.
Really?
And gut stuff. So we'll see a lot of people get their wisdom teeth pulled, develop a cavitation, and then have gut issues or not be able to get pregnant. Or
what?
Yeah. So a lot of times we can take root canals out, clear a cavitation, and women's fertility problems are a problem no more.
That is amazing. So I remember there's a doc in my neighborhood, like in the neighborhood or in the health neighborhood in Franklin. And he was saying that he would always check like a machine that you can get like a biological dentist or a healthy-minded dentist. I'm not saying they're not healthy-minded. I'm just saying like mostly like a holistic type dentist.
Yes.
And they were like measure, like they say if a tooth is dead. And then I got sent a video and it said that if they measured a tooth, because the teeth are like batteries. And it was a medical doctor that was on video, and it said that if you are in a positive charge, like you have a positive and negative pole of the battery, and all the electrons were pushed towards the positive side, that person usually have a tumor or some kind of cyst in the organ related to the tooth.
Wow.
And that crazy. I was like,
I totally believe that.
And he said he would measure. He said that the dentist didn't relate to me. He said that if you did the measurement on the tooth and they gave you a certain level of positive polarity, they can almost guarantee you had a hidden cyst or tumor.
Whoa.
And I can't. I mean, I think it's great.
I honestly
crazy.
feel like so many mystery patients, that's what's wrong with their teeth. I mean, I've seen people, they can't breathe through their nose, they're mouth breathers, they have a parasitic marcon, so mold in their sinus cavities. They have all this stuff going on, huge tonsils, and it's all from their teeth. It's all from cavitations.
Good heavens. So it is a good thing for people out there, like if you had wisdom teeth taken out, if you have teeth bothering you, so the first thing probably be like do some like cone beam, or what was that what you would do?
I would say people who have an infected root canal who don't know it, it can be dark around the gum line. Yeah. Right? There can be pain when they chew. There can be a weird sensation sometimes. Like the body's so smart. Don't ignore that. Don't ignore that. That's your body telling you, hey, there's an issue here, guys. Come on. And so, yes, the first step is a cone beam scan, a 3D cone beam scan.
Yep.
And I would beg people not to have a conventional dentist read it because they don't think that anything is wrong with root canals, so they don't have a trained eye to see if there's an infection there because they don't believe that. So a biological or holistic dentist, and get a couple different opinions because this is a scan that can be read objectively a number of different ways. And so
chart wars.
Yeah, scan wars. Yeah, exactly.
Chart wars.
It's a show on Bravo. I can already say. Yeah, so it's and then so get a couple different opinions, and if you've done everything else, if you've done nervous system and drainage and detox, and you're still sick and can't figure it out, this is probably the reason. I can almost guarantee it. So so be really diligent about your teeth. Yep. If you know something's wrong, there's probably something wrong.
I mean, I'm with you because you're hitting nails on the head with me because I want to talk just a little bit, circle back about what you would recommend for like just initial lymph drainage because that's important. Yes. But the thing was the patient that had one of my patients came back and she'd had lymph nodes consistently on her arms and it just kept getting tight. Whenever I checked her though, it would always go to her pericardial meridian, which goes up. The meridian goes like underneath the armpit. So I'm like, okay, so heart, but she's had heart issues from her fat past. Get this though.
Oh, interesting.
But you're hitting the nail on the head because she finally was, I was like, every time I had my biofeedback device, I was like finding areas around here. And I was like,
oh, wow.
and I was like, what? And she goes, yeah. She's like, I went to the dentist and I'm thinking I got a root canal here and I've got to get a tooth taken out here probably.
That's it.
And when you press down to do a muscle test, it was totally weak. And I was like, so then I lasered it.
Yep.
And she didn't have any heart palpitations for like 3 weeks.
That's right. I mean, you got to think, these cardiologists, they give, oh, you're going to the dentist, let me give you this antibiotic. Because they know that you spray bacterial emboli from the teeth into the heart area, into the valves. They know this. They give you antibiotics before they work on your teeth. For this reason, absolutely connected to the heart. Absolutely.
See, this is why I'm glad we're on. We got to have more of this. Okay, so you go get the cone beam, you find somebody that can read it. And then if you also too, like if you suggest that you need lymph drainage too when you're doing this stuff, what would you suggest? Like, is there something that you like to do?
For sure. Now, listen, there's a million different recipes depending on the person for lymph stuff. It's, whatever floats their boat, honestly. But what I like is very simple and very free.
Yeah.
And it's really just breath. Breath. Because the lymphatic system doesn't have a heart like the circulatory system. It just has the diaphragm, which is a muscle that moves with breath.
Oh man!
And
what?
Yeah, and so really, if you want your lymphatic system to move, if you want all your organs to be draining and not be stagnant, you need breath and oxygenation, which washes away toxins.
So you would think, you would suggest like breath work and those things, like learning how to breathe and how to go.
Yeah, you almost need a breathwork coach because there are some people who don't know how to breathe, and this sounds very like paradoxical, but they literally don't know how to exhale.
Like they don't, I mean, sure, seriously, you're saying like some people could just breathe a certain rhythm and it's not beneficial for their body.
I mean, their exhales are like,
yeah.
It's like you haven't got any air out of your diaphragm and the rest of your body at all. You're not exhaling and moving anything. It's like a hydraulic pump, right?
So you're barely pumping the pump and you're expecting all your lymph to clean out and it's not done.
And there's no way. So the first thing that's the simplest thing for everyone is just learning how to breathe. With breathwork exercises, learning how to breathe into certain areas of their body. Yeah. You mean put your fingers on beside people's spine, on their paraspinal muscles and their back right here, and say, push my fingers away. Breathe into the back of your back.
And they can't.
There's so many people who can't right away. You can teach them because the biggest nerve runs in the posterior mediastinum.
Wow. Is that why when you teach a person to breathe, like sometimes I've had patients where I say, well, just take a big breath in, and then they'll go, well, I feel kind of like buzzy and lightheaded, and it's like, is it just moving the lymph because they finally started unlocking it? Yeah,
exactly.
Sheesh.
And it's just, they probably haven't had oxygenation in certain parts of their body for a really long time. I mean, it's almost like a neglect, like if somebody had a stroke and they neglect certain parts of their body.
Yeah.
It's like they almost do that subconsciously as they've gotten older and got tattoos and patterns and walking in their body a certain way.
Yeah.
And they don't know how to exhale and feel that part of their body anymore. They can't put oxygen in there anymore, which is why yoga is so helpful for so many people.
So they get that. That's why some people say, I swear by yoga. And I have to do it because you're actually putting oxygen into their system.
You're breathing with the movement. It's like a moving meditation. And then they'll say things like, breathe into that external hip when you're in pigeon pose.
Yeah. What does that mean?
And some people are like, what does that mean? How do I breathe into my hip? Yeah. But the more you do it, the more you're like, oh, that's how you breathe into the hip.
That's exactly right, because they'll do the, I'm not a great yoga person at all. Actually, I went to a yoga class one time and I wore boots.
He let you in the room.
I went with Dr. Axe and we went out, we were in New York, and he looked at me, he goes, really? Really? And I said, I don't have any other shoes. Anyway, but when you're breathing into like the stance, and I think it was Sun Warrior, but also too, they were saying, breathe into your kidney. Yeah. And I have to tell you, like I believe, because I do, Chinese medicine, but it was like you could feel the energy and the air going into my kidney.
That's right.
And I remember that rest of that day, I had to pee a lot more, but it felt, it was like a good cleansing. And I was like, that's what they mean by breathing into it. So you're breathing into it, you got lymph, you got your teeth. Now, okay, so I do want to touch a little bit about like the breast implants, because there's a big thing about, was it breast implant sickness, or is that what they call it?
Breast implant illness, yeah. BII.
What is that like? I know you've dealt with that. What is like some of the main things you would tell a person who, not to be scary, just to ask about a person who does have it?
They'll have lots of lymph and fascial problems, like we talked about, because there's platinum cross ties in the breast implants. And a lot of the platinum cross ties and the silicone, which is not silicone is natural. Silicone is a man-made compound, and it can migrate and actually look like these granulomatous tumors to doctors on scans, and they think they have cancer. Now, there is a higher risk of breast cancer with breast implants, a certain type of leukemia with breast implants. But there is also people aren't told full informed consent. They are not told all the ingredients of breast implants by the manufacturers. They don't know there's 30 different heavy metals and epoxy resin and polyvinyl chloride that was in the Ohio derailment spill. They don't know that.
That is alarming.
And then platinum cross ties and silicone. And so all of this is nothing natural to the body. If there's any leaching whatsoever with these implants, so you can't even see if you have an infection in teeth. You're not going to see a little rip in a breast implant on a scan.
That's exactly right.
You're just not. And so unless it's completely ruptured, they're not going to see it a lot of times. And so people will come up with these mystery symptoms, like autoimmunity is a big one. Yeah. Autoimmunity, fatigue, brain fog, like all those vague symptoms, pain, and it doesn't look like it's connected directly to the implants.
But it is directly, because, I'm telling you guys, these are bringing up some thoughts. I know you've seen this too, but guys, I had a patient, I remember this story, where she had got to a certain age, and she said she just got super sick. When we finally, after about 3 or 4 months working with her, she finally went back. She goes, that was the time I had breast implants. And so we were like, what? And she goes, yeah. She goes, yeah. So we started investigating, but every time, like with the work I do, we all do our different styles. I kept finding a toxicity signal on all the meridians right around here. And I was like, okay, I said, I don't know, but I think you need to go get it checked. She gets it checked. He is definitely ruptured. She said, okay, when they opened up, she got to keep it. And one looked like that was full was okay, but it was calcified all around it.
Yeah, that's what the body does to protect you.
Is that what it is, calcified?
It's called a contracture.
And it
embeds into the wall of the breast tissue.
That's what she said. It hurt so much after they pull out. The other one looked like a shower curtain that had mold on it.
Yeah, they grow mold. Absolutely, they grow mold.
Really?
So this is a source of mold in the body for people. So what I mean, it's like these interferences. If you want to stay healthy and keep infections away, this is something the body constantly is trying to keep clean for you, and you're losing energy. That's why people are so tired with these things.
So, we're talking about the whole energetic system. That's why we like longevity here. It's like we're talking about we don't want to hyper focus on the breast implants. But you need to clean. What it's doing is robbing you of energy, so you can't live your life.
Correct. It's a constant source of exposure of a toxin in the body. It's not like something we breathed in or ate that we can get rid of. It's always there. It's always there.
So your body's always going to be creating like a histamine response, a mast cell response.
Correct.
So the things that we're saying is you need to look at some of the things that were man-made devices and things, and kind of take an eye on that and look into it. Mm-hmm. And this people are going to chew on this for quite a long time. And this is okay. So we have terrain theory now. I know time's precious because we're here, and Jess is very needed. So we got to make sure her time's valuable. But I was going to ask you just one more thing. When you see with how the healthcare, even in functional medicine, is going. Can you give us your perspective about how you want it to go, or where it's going, and what you think that people should look into and desire in functional medicine?
Yeah, I will say that there's an explosion of functional medicine in the last decade, I would say, explosion.
It's a lot.
It's a lot, and I see a lot of great things, a lot of good knowledge getting out, but I also see a lot of ego and a lot of competition, which is unfortunate, and I also see a lot of green pharmacy, which is where people are looking at labs and everything that's wrong, they're spot treating it, which is the conventional medicine way. Only with natural medicine they're doing it now. And I try not to give more than 6 to 8 things to a person at once.
Yeah.
Because I did that as a hospitalist. I gave 30 things to people on discharge. So now I'm trying to be a different person. And I feel like the body can only handle breaking down so many pills and capsules and everything. And so I see a lot of people doing green pharmacy. I see a lot of ego in the business.
Yeah.
And those are the things, the 2 things I think I wish didn't happen. They bother me the most, probably. And then really a lot of looking at things that I don't think are root cause.
Gotcha.
Yeah.
So, for people out there, they want to hear, it's okay, so if, we've had this before, unfortunately, sometimes I go to a practitioner and they'll come in and they say, they gave me a B6 for this, they gave me a B1 for this, they gave me this, and then they gave me this and this enzyme to do this, and they come in and they're already frustrated by the time they said, I've already spent like $800, and then they're like, and then I feel bad because I'm like, I don't want to give you any more.
Right.
I got to just work with what I have. So there's this need. So it's good to look out for a functional medicine doctor who says, okay, let's try to work with what your body could handle.
Right.
And that's what you say, look out for that kind of practitioner.
And it's so expensive, like you said. It's so expensive too for people. How do we fix that for people?
It is. And so when you need to look for the doc that does that, and then look for like when people may go down different routes of what a real true root cause are. So I would just suggest to everybody listening, like, watch Dr. Jess's Instagram feed and get good results with the test she recommends, because I'll watch it and I'm telling you, I will say, like, they'll ask my patients last what test, and I'm like, you just need to go check out Dr. Jess's page. No, I'm serious. There's so many new tests that are coming out. I'm asking about that because sometimes there's so many new tests. I'm like,
it's overwhelming.
It's a little bit overwhelming.
It's overwhelming.
Like I get there and they're like, did you hear about this new neurological toxin test? Which I think is awesome. And I'm like, I got to go study that, And then, everybody has good intentions, I believe, in their heart, but there's a lot out there.
Yeah, it's as we're so stuck in the weeds. Sometimes we don't see the forest for the trees. And so I feel like if we pulled back and we just said, what are really the best doctors? Sleep, community, sunshine, good food, movement, breath.
That's right.
Right? And are you doing those? Then we probably wouldn't need all these tests. We probably wouldn't need all these supplements. People need a community. They need to feel like they belong and they're safe.
Yep.
And that's where everything branches out from, in my opinion. And so we can do all these tests. We can create all these tests. We can create all these supplements. We can create all these biohacks. But ultimately, are you living life that is conducive to how our ancestors and nature wants?
That's right. That's right.
This
is good. I'm telling you, I'm so grateful. I know, Jess, thank you for the pleasure.
You were great. This is such a little flowy, great interview. You're a great interviewer. Yes.
I'm just saying, this has been so informative, and I want people, when they watch, to be feel easy with it. It's like, no, I can go and listen to this, and I can actually do something about it.
Yeah, because ultimately, I think the last thing I want to hear is that people are hopeless.
Yeah.
And they feel helpless. And I just want them to know that knowledge is power. And it may sound scary. I don't mean to scare anybody by telling anybody this, but you can take this information and go find the right people that will help serve you.
Mic drop. I'm telling you, that's right. You got to find the people that serve you. And I'm saying with all my heart, this has been great.
Thank you.
So, Jess, tell the people how they can find you and your website and how they can work with you.
I always say there's hierarchy to these things, however you guys want to do it. Yeah. So, if you like the free stuff, I'm up on Instagram just like Dr. Motley here, Chris here. And we do a lot of education, and so that's free always. I have a wellness platform called Wellness Plus where I teach you how to be your own best doctor. And it's there's an uncensored community forum where docs answer. There's some protocols, and we're revamping the whole thing for next year. And then I have a supplement company called Aegis Formulas, where we have a couple different supplements, and we're launching peptides that dissolve on the tongue and have 100% absorption in January.
I'm part of that.
Yeah, we have BPC on there, so one of them. So, and then finally, I have a virtual clinic where you can see me in person, and I have an 8-month or a 4-month package. So there's lots of ways.
Oh, man. It's like Dr. Jess MD is here. Just watch her information. Please, I'm just saying, I think everybody out there is refreshed that somebody is looking out for them. And I really mean that.
Same for you. We need more doctors like this. We really do, like you. We need more doctors who tell the truth and are vulnerable and who are seekers of knowledge.
Yeah. I always thought that'd be the coolest hospitals would be the ones that had a floor where there's so many different practitioners that just really said, we got to look at it holistically. Maybe we could put our heads together.
Can you imagine?
Oh, a different world. But guys, we are so thankful that you guys joined us today. And so if you like this information, like and subscribe, give us a thumbs up, hit the little bell to get reminded when, new episodes come up. And just check Dr. Jess's information out. We're here with Dr. Javen Moore too. He's doing some stuff. We all have a lot of good conglomerate of people that care about each other, and we're all here about sharing and loving each other. So guys, we care about you. We thank you for joining us here at the Ancient Health Podcast. Until next time, have a great day.